faced with this outbreak, the world is looking to us, the United States, and it's a responsibility that we embrace. We're prepared to take leadership on this, to provide the kinds of capabilities that only America has, and to mobilize the world in ways that only America can do. That's what we're doing as we speak. First and foremost, I want the American people to know that our experts here at the CDC and across our government agree that the chances of an Ebola outbreak here in the United States are extremely low. We've been taking the necessary precautions, including working with countries in West Africa to increase screening at airports so that someone with the virus doesn't get on a plane for the United States.
There is not one single doubt among those who understand medical and military issues. American troops are necessary in places such as Liberia and Sierra Leone at the moment in fighting Ebola for no other reason than Americans are better prepared to deal with emergency situations and understand logistics better than most nations. But then there is also the matter of having enough doctors, a world that must weigh in with us, and the reality to those being told, we have nothing to worry about. Welcome to MidPoint. Founder and host of The Doctor Weighs In and board-certified internist and emergency physician, Dr. Patricia Salber joins us. Dr. Salber, thanks so much for being here today.
My pleasure.
I'm going to begin with a quote and a piece of sound, if you will, from Dr. Anthony Fauci. He is the National Institute of Allergy and Infectious Diseases Directors, simply put, talking about the mutation possibility and the virus itself. Here we go.
If this virus keeps replicating and keeps infecting more and more people, you are going to give it more of a chance to mutate. So the best possible way that we can take that off the table is to actually shut down this epidemic. And if we do, as I always say, a virus that doesn't replicate doesn't mutate.
Dr. Salber, when he talks about going in and taking this action, getting right to it, shutting down this epidemic, in your opinion, and those you speak to as well, is it not proper to say what I noted at the beginning? They call on America because we have the logistics, we have the knowledge, we have the intelligence, we have the money too, but we also in many ways are the only nation around the world who really can grab hold of this, take hold of it, and try to get something done that really needs to be done both medically and militarily.
Well, yes, I think that we are in a position to do that. And I think that sending the military in was a very good move. As you said at the beginning of the segment, it's because they are the experts in logistics, and that's sorely needed right now. But there has been a global response. The Chinese have sent in an epidemiologic team, of course, medicine, Doctors Without Borders, the French group, has been operating in Sierra Leone, and even Cuba has sent a team of 130 doctors. So there has been a global response, but I do think the importance of what we're doing is that we'll be able to go in and to start getting the response more coordinated.
Are there enough doctors? And the doctors that are being sent by all these countries, you're right, we're getting the help. But, and I hate to put it so simply, but are they the right doctors? Are they good enough to get this done and to fight this epidemic?
Well, right now, the main treatment is what we call supportive care. So it's giving people fluids, whether by mouth or by intravenous infusion. So it's not really advanced. If these patients were in the United States, when they start to decline rapidly, we would probably put them in an intensive care unit with isolation, but those facilities by and large aren't available. So the care that's being offered is really supportive care. And Dr. Fauci is right. What we really need to do is we've got to stop the transmission of this virus from person to person, so we can not have to deal with trying to build up an infrastructure to take care of sick people.
We talk about quarantining as well. Here's an interesting note. In Sierra Leone, there has been a lockdown, a nationwide 3-day curfew. Citizens not allowed to leave their homes from Thursday until Sunday. Is the fear here that in nations such as Liberia, Sierra Leone, and others, that we may, militarily speaking as well as medically, have to shut down an entire country and do something to keep people from leaving, period, end of statement, in order to stop this disease?
Well, you know, of course, we did do that. If you look back hundreds of years, that's exactly what we did during the times of the plague. But I think that it is important the kinds of precautions that we're taking to keep people from these countries leaving and going into other countries, such as the person who arrived in Nigeria and accounted for, a tiny number of cases that took place there. The problem with quarantining, particularly if you quarantine, for example, just a village, is that the people there get really frightened, and then you have a logistical problem of how you feed them. So we do need to do case finding. We do need to isolate people, and we do need to work with the locals who are right now taking care of people still in their homes, right? The traditional way they've always taken care of sick people. And the other point of transmission in this disease is the cultural practices of preparing the body for burial has led to infection as well.
Is it really feasible, though, to shut down an entire country? I know you mentioned the plague, and we can think back, but there weren't airplanes, there weren't all these various forms of transportation. It would seem physically impossible to shut a country down.
Well, I think you're right. I think that we could do the best we can, but there will always be people who are so frightened and want to get out of there, who may be infected, that people will find a way to get out. So we probably couldn't shut a country down with 100% certainty, but we can put procedures in place to, for example, screening at airports, which is taking place all over Africa, but is also taking place at portals of entry in the United States, to make sure that people, if they get into the country, if they get into another country, that they're immediately identified and then isolated and evaluated to see if they have the disease, so they can't transmit it through another country.
We talk about warning Americans here and certainly being prepared. I'd like you to hear the words of Lamar Alexander, Republican senator from Tennessee, when he spoke specifically about Ebola and used one word, 4 letters, that we talk about an awful lot these days in comparison. That word is ISIS.
We must take the dangerous, deadly threat of the Ebola epidemic as seriously as we take ISIS. I think I have a reputation as a senator who's not given to overstatement. I don't believe that's an overstatement.
Do you agree with his assessment?
Well, this is considered a security issue. I think that, that we've heard from the president of Liberia that she thinks that her country's, on the verge of collapse and chaos as a result of this disease. And when a country's in chaos, then it can lead to problems that spill out of the country and affect other countries. And I do believe that that's both what the senator was talking about and also what President Obama mentioned in his speech as well.
Are we perhaps a little too cavalier here in this country about things like this simply because it's a world away and because we're used to 21st century medicine, that maybe when certain people tell us you should be prepared, you need to be just a little bit frightened, that maybe we don't take them seriously?
Well, it depends on who you're talking about. The CDC has actually sent directives out to healthcare providers across the country, telling them that they need to be prepared for getting cases of Ebola, telling them exactly what to do. For example, telling them how to send samples in for testing and so forth. So I think that we are starting to take precautions. I think the general public kind of vacillates between being afraid and then being told they don't have a risk and calming down and thinking, as you said, that it's a world away and it's really not our problem.
I got about 90 seconds left. I wanted you to respond to this too. There's a report out now that patients are turning to the black market to buy blood from the survivors of the virus. This comes from the World Health Organization. Apparently the blood is said to have antibodies that can fight the deadly virus. That has to be frightening to you to see that this is now on the black market and what this could do to actually try to contain the disease.
Yeah, I read that this morning, and here's the problem with that. First of all, when anything's sold on the black market, you don't know it is what it's said to be, so it may not even be the blood of people who've recovered. That's the first thing. But the second thing to understand is that there are other bloodborne diseases that are prevalent in these countries. So, for example, HIV. So you could, even if you've got something that had the antibodies that could help you recover from Ebola, you may have just infected yourself with HIV. Not a good idea. I agree with the WHO that this needs to be stopped.
About 30 seconds here. Do you fear weaponization of this disease at any form?
Well, of course, that's a fear not just with Ebola, but with other, deadly infections. And I do think it's something we need to pay attention to. There is a bright light that there's now a vaccine trial. I believe in Britain, the very first volunteer has received an injection of this vaccine. And my hope is that we will speed development and have much more rapid development of vaccines that can prevent people from getting this disease, which of course would reduce the chances of this then becoming weaponized.
We will hope with you as well. Dr. Pat Salber, thank you so much for your expertise. I hope we have a chance to do it again soon.
Thank you.
Later this hour, the Secretary of State ripped into it. The latest hearings on Americans going to war is something talker Ed Dean will weigh in on a whole lot more. And after the break, those truly suffering at the hands of government business regulations are those who can afford it least. It's on MidPoint.